Hello, good morning, good afternoon, good evening, wherever you are. A very warm welcome to Meet Menaca, episode 90, Caring for Your Heart with Dr. Kulasegaram, Ranjadayalan. It's an honor to have him on the show today. Meet Menaca is a talk show. It's a 90 minutes free event where we invite experts to share their wisdom and ordinary people who have had extraordinary lives who will help the social change we really deserve and to thrive. This is a platform to celebrate each and every one of you. The humble request for you to support us by subscribing to the YouTube channel Meet Menaca so that we can share these messages far and wide across the globe. Firstly, a huge thank you for you, Dr. Ranjadayalan, for agreeing to come on the show.
It is my pleasure, and thank you so much for inviting for your very prestigious forum. And I hope this is going to be useful for the attendees. Thank you.
Thank you so much. And it's people like you who will hopefully one day will make it prestigious. Thank you so much. I'm humbled to have you.
Thank you.
A little bit about the speaker. I'm sure for most of you, he doesn't need any introductions. For those who haven't come across him yet, Dr. Ranjadayalan qualified from the University of Peradeniya in Sri Lanka in 1979 and completed MD in Sri Lanka in 1985. He obtained his MRCP UK in 1987 and is a fellow of the Royal Colleges FRCP Edinburgh and London. Dr. Ranjadayalan currently working as a consultant cardiologist for Newham CCG, an honorary contract with Barts Health. As I mentioned, it's a huge privilege to have him on the show. And for people who are on the Zoom, you will have the exclusive possibility to ask questions directly to him after the first 60 minutes. And please send the questions to either to Raj Madhavan or Dr. Lakshmi Vedayadhar if you want to ask a question confidentially. So without further ado, let's dive in. Today is about caring for your heart. As an expert, can you explain, Dr. Ranjadayalan, why should we talk about heart health to begin with?
Heart is a very active and an important organ in our body. Even before we are born, it starts beating and it beats till our last breath. Per day, it beats 100,000 times minimum a day. So it's a very active organ. And still, all over the world, this seems to be the most common cause of death, which is to a large extent preventable. So it's good to talk about heart health.
So when we talk about caring for your heart, what do you mean by that exactly?
So there are various types of heart disease, but generally when we talk about heart disease, we refer to a disease of the coronary arteries. There are three coronary arteries which give the constant blood flow to the very dynamic heart muscle. When one or two or three of these arteries got narrowed or blocked, then we call that is coronary heart disease. And fortunately, it can be delayed or preventable, which we'll be discussing later, with very simple measures. So it's better to talk about coronary heart disease in particular today to see where we stand now regarding prevention or delaying the condition. And even after getting the condition, there is so much we can do to arrest the progress and improve the outcome.
Thank you so much, Doctor. So why do people get heart problem in the first place in that case?
Yeah. So to answer that question, of course, the very first study was a Framingham study, started in 50s, and very good study where they followed up a large number of patients. That was a US-based study. But to quote a very recent latest trial is done. It was published in 2004. They wanted to look at every country in this world. So they covered all the continent, 52 countries, every single ethnic group, and did a very interesting study on 30,000 patients. 15,000 of them presented with the very first heart attack and looked at their risk factors. And they found 90% of these patients who presented with a heart attack had a modifiable risk factor, at least one, but most of them had more than one. Only less than 10% of these heart attack patients had unmodifiable or unrecognized risk factor. So that tells us two important things. One is there is no wide variation among different parts of the world and different ethnicity regarding the risk factors. It is universal. And the second thing is 90% of the time it can be prevented or at least delayed.
Thank you. So you said that they're modifiable. So how does it impact the coronary heart disease, and what are the modifiable factors?
Good question. So the four most important modifiable risk factors are the very first, so the highest predictor was the high cholesterol, which we knew, but it just confirmed further. If you believe world is round, you should believe high cholesterol causes coronary artery disease. Even if you don't believe the first, you must believe this because evidence is so overwhelming. High blood pressure, no doubt, it is an important risk factor. And diabetes is an important risk factor. Something related to diabetes, which is a very important topic as a risk factor, is we call it medically metabolic syndrome, but it is due to insulin resistance. And we always check the weight. Weight is not an accurate predictor of cardiovascular disease risk. It is the waist circumference. So that what we call an abdominal obesity is more accurate predictor of the risk for atherosclerosis or fatty deposits. And another very important, very interesting risk factor they came across was stress. Till this paper was published, the cardiologists, even the population divided, most people did not believe how can you measure stress and how can you prove that it causes heart problem. Now we have no doubt whatsoever. It is coming under the rank of within the first 5 risk factors, modifiable risk factors, stress, which is an important new and confirmed risk factor for heart disease. Of course, the other bad habits like smoking, no doubt it prevalent around 30% of the population, and stopping smoking. And they looked at only current smokers. So that became as an important risk factors. There are other factors. That is where the diet comes in. There are 3 negative risk factors. People who did regular exercise or physical activity of more than 30 minutes for 5 days a week had less risk of getting heart disease. Alcohol in moderation, less risk of heart disease. I have to be careful about that. I'm not encouraging to start drinking alcohol for health reasons, but if you're drinking, fortunately, unfortunately, it is good, temporarily at least. And the third one is those who ate vegetables and fruit. So in other words, they were eating more fiber diet. They had less chance of developing heart disease. So these are the 9 risk factors very clearly shown for 90% of the population. So if there are more than one, the risk is much higher and it happens earlier.
Thank you. Did you mention ethnicity as a risk factor?
Yes, right. What I have mentioned is only the modifiable risk factors.
Sure.
Well-established, unmodifiable risk factors are age as we get older. And being a male is also a risk factor. That's why before the age of 60, men get more heart disease than women because of the protection by the estrogen. But after the menopause, then they catch up. Then the third unmodifiable risk factor is ethnicity. And for that matter, unfortunately, we South Asians have the highest risk of dying of cardiovascular disease, not only getting the heart disease. When we get the heart disease, it is much severe, much more complicated, and also it happens prematurely. So it happens early. So we have to be even extra cautious about cardiovascular disease, particularly coronary heart disease.
Thank you, because the reason I brought up ethnicity is it is a risk factor. Our audience are predominantly South Asians. Is that correct to say we are at higher risk for?
No doubt whatsoever. In fact, a lot of people say you are the fastest dying race in the world because of this. But fortunately, for every bad news, there's always a good news. We can do a lot about it because there has been a lot of very well-defined, accurate scientific research now has got to the bottom of it, not the full story, but at least now we know why we get this disease more than a Caucasian. For example, if you take the UK, we have the highest prevalence rate of coronary heart disease, that is South Asians living in the UK. One of the main reasons for that is not only just diabetes, we call a condition called pre-diabetes. That is, everything is there, but not full enough to say, you are a diabetic. And that term is called metabolic syndrome. That's a medical term. But easy to know is we all are, South Asians have a tendency for insulin resistance. That is, even though pancreas produces sufficient amount of insulin, our body is resistant to insulin, partly genetic, but not 50-50. Roughly around less than 20% reason they say genetic. And why genetic? Maybe because we all had a smaller pancreas and various other explanations. But we know for sure insulin resistance can be delayed or even prevented by simple lifestyle measures. And it's never too late, but even if we get to the level of having very high risk of developing vascular disease or develop vascular disease in an Asian, then there's a lot we can do to treat that.
Thank you so much. We spoke about non-modifiable and ethnicity being one of those. Stress also has been identified as a factor of cardiological problems in the recent years. So as an expert, what can you tell us about it?
I wouldn't say I'm an expert on stress, but one thing I know for sure is stress has a direct link to coronary heart disease. In fact, very interesting that in our films, cinema films, it is common seen where when the parents get upset with something emotional, immediately they clutch their chest and they either die or taken to hospital. And we used to laugh at that, especially being medical person. How is that possible? But now we know without a doubt that one well-known trigger for heart attack is stress. That is the acute thing. So at all costs, we must avoid the stress because that's a well-known trigger. That applies to any human being, but more importantly, anyone with high risk or established heart disease should at all costs avoid stress. The second thing is chronic stress does a lot of bad things to the body, including causing what we call a chronic inflammation. As a result, there is a very high risk of developing these fatty deposits inside the artery. So the degree of narrowing of the arteries get worse if you are stressed. So stress management is part of the care of the heart. And in this particular study, what they looked at is much detail. They looked at 3 types of stress. One is economic stress, financial stress, domestic stress, and also work-related stress. So it's very, very important. It's a double-edged sword because if you are stressed, there is highly likely, it is more infectious, you give stress to others as well. and by which you cause not only problem for your heart, also others' heart. So it is very important to manage the stress very well than for both your health as well as your friends and family's health.
Thank you so much. Only in the recent years, isn't it, we are talking more about stress and how it contributes to ill health in general. You also mentioned diet as one of the things we must pay attention to. Though most of us generally know about it, we don't perhaps know the specifics. So firstly, what components of a diet is good and what components have negative effects? And secondly, is there anything else we must bear in mind other than what type of food we eat? So for example, how often we eat, and will it have an effect on it? And when we eat as well?
Yes. So the prevalence of heart disease is still increasing all over the world, in certain parts more than others, in spite of all this advance in technology, treatment, as well as advice. Partly we are to be blamed. When I say we, the health professionals, because we have been giving wrong advice to the people, especially since late 70s. There had been a U-turn about what is the better diet for vascular disease. The very first important message is carbohydrates we don't need for our body. It is toxic. If you take the three components, the macronutrients we eat, carbohydrate, fats, and protein. Out of these three, the worst evil is carbohydrate. Sugar is toxic. And some people go to the extreme of saying you don't need sugar at all. There's nothing called essential carbohydrate. There are things called essential fat, essential proteins for the function of the body, but you can easily survive. No one will die of lack of sugar. So whatever sugar we eat is toxic because there had been extensive work done why it is toxic. For example, very simple example is sugar is converted to fat in the body, and sugar is worse than saturated fat, which we have been avoiding. Saturated fat is also converted to fat, but it converted to, according to the latest research, is to, in a way, slightly better cholesterol than sugar conversion is to a bad cholesterol. And not only that, sugar produces more insulin. Insulin is toxic. The native insulin, natural insulin is toxic to the body because it keeps on storing. So please do not eat any food which stimulate insulin production. And the worst of which is refined sugar. White sugar is bad. Fast food is bad because they have refined sugar like donuts. White bread is bad. Any high glycemic index means a carbohydrate food which causes a rapid rise in sugar, hence causes a rapid rise in insulin, you should not touch. So you can check the glycemic index of any food. And the best glycemic index of carbohydrate in the vegetable. So if you eat enough vegetable, you don't have to touch any carbohydrate. So sugar is toxic, particularly now this is another U-turn is fruits are bad. They are terribly bad. I shouldn't go to that extreme because there is still a belief you can eat certain fruits, but any sweet fruit is bad for heart, brain, and the blood vessels. The reason why fruits are bad is because it has fructose in it. And fructose is metabolized very badly in the liver into fat. So any condition where you have abdominal obesity, the very first thing to avoid is fruits or fructose. And fructose, unfortunately, thought once it is a better sugar than glucose, maybe for a genuine reason at that time, or maybe for commercial reason, then they started substituting every processed food with fructose syrup, which actually increased the prevalence of heart disease. In fact, there is a nice correlation between the publication of that dietary advice and the prevalence of stroke, heart attack, and any other vascular disease. So we have taken a U-turn. You don't need sugar. Sugar is toxic in every way, but saturated fat received a bad phrase. It is not bad as sugar. So if you are to choose, you can choose a fat rather than sugar. Protein is always the best, simply the best, because it never produces an insulin secretion. It gives you enough satiety and satisfaction, and it makes you look good. And in the fat, again, the important thing is if you can eat liquid fat, olive oil, ginger oil, anything oil is good. Avoid butter, margarine, because any solid is saturated.
Thank you so much. I just wanted to clarify two things, because berries particularly, they said it's very good for brain health and perhaps for heart. Is it true, or should we avoid one thing? And secondly, olive oil, we all switched from coconut oil to olive oil and now avocado oil. But they say if you are going to cook with it, it is worse than using coconut oil in the first place. So I just wanted to know your thoughts about it.
So first question about children. Yes, the dietary advice for children is different. I'm not an expert in children, so better to include. For children, nutrition is equally important. It will have an impact. For example, the salt intake of within first year of life, they, like in infancy, had a strong correlation with the systolic blood pressure later in the life. So it's very important that to look after the healthy nutrition in the first year of life. But the main difference, as far as I know about fat intake in children and adults, is if you take polyunsaturated fatty acid, there are two polyunsaturated fatty acids. One is omega-6, other one is omega-3. Omega-3 is excellent for heart and brain. And we don't need omega-6 because it is pro-inflammatory, and in fact, it can be harmful for the atherosclerosis. Having said that, children need omega-6. So that's why my advice about certain food items, particularly regarding fat, does not directly applicable to children because they need a certain amount of fat, and because they are growing. So when they grow, they need certain amount of calories and fat and even carbohydrate, maybe.
Apologies, I should have been more specific.
Yes. Yeah. Olive oil is simply the best. There's no argument about it because it is a monounsaturated. If you ask me which is the best oil to live longer and healthy, olive oil. The reason is because it's monounsaturated. But one thing we should remember, again, we didn't emphasize it before. Now we know. When I say now, it is 15 years at least. You should never fry a food. Any fried food, whether it is good oil or bad oil, is bad. Because for two reasons. Because the beneficial effect of unsaturated fat goes off when you fry. The more heat you use, the worse you make the oil. So never use an olive oil to fry and say it's olive oil. So that's no, it doesn't apply. And the best dietary advice, nutritional advice, as far as I'm concerned, is avoid any fried food, whatever oil you use. Coconut oil is a very interesting thing. There's no doubt coconut oil has saturated fat. But there is a political aspect as well as a scientific aspect about coconut oil. Still, the jury is out. But one thing I can say, if you want to compare the coconut oil and olive oil, they have done that study, scientific study, and shown very clearly olive oil far superior than coconut oil. But coconut oil is not bad as we thought. So there is some strong advocacy saying out of all the saturated fat, coconut oil is better. And other sciences, it is oil. So oil is always better than a solid fat. So frying is bad news. So we shouldn't have a fried fish and say, I'm getting enough omega-3. The benefit is gone. So I know it's very tasty and we are very fond of fried food, but as much as we can avoid, it is better for heart health.
Thank you so much, because most of us do fry things. So I just thought it's important for us to know. And even cooking curries, it's never just stir fry kind of a food, right? What we have. So that's the reason I asked that question. So thank you so much for clarifying it. I have heard the experts say that heart attack or heart failure happens at a certain time of the day. Is it true? If it is true, what are the reasons for it? Because for a layman, it seems very interesting that it happens at a particular time of the day.
It is absolutely true. For both heart attacks as well as a particular type of stroke, we call it ischemic stroke, which has same underlying mechanism of fatty deposit in the cerebral arteries, the neck arteries. And particularly between 6 a.m. and 7 a.m. is the worst time for these two conditions. And we see it all the time. Every single day when you go to the hospital, you see more heart attack patients and more stroke patients between that time period. And there is explanation for that. Of course, there is more than one explanation, so they don't know definitely which is the primary factor. I'm sure they're all that contributes. One is a sudden surge in blood pressure, particularly the top reading, systolic blood pressure. When we sleep, especially when you have a very nice sleep, our blood pressure and heart rate are in the perfect healthy level, the lowest possible, and the brain rests, rest of the body rests. The moment we wake up, problems start. The blood pressure change. In fact, we see it all the time in the 24-hour blood pressure check. And we specifically look at the time between 6 and 9 a.m., what happens to the blood pressure, whether they are on treatment or not. And usually it goes up. And the explanation, they say, I was getting ready for work and I was very concerned, I was rushing and all this. But that sudden surge in systolic blood pressure particularly is bad. And that is the most likely explanation for the stroke. The second reason is there are a lot of hormonal changes taking place, which including cortisol level. The higher the cortisol level, which is a stress hormone, higher the risk of heart attack and stroke. That's the other explanation why stress predisposes to these acute events. And they have measured the stickiness of the blood, and in two ways. One is they measured various chemicals in the blood, how easily they are clotting in this particular time, and they are proved beyond doubt that they are more sticky in that time because of the various hormonal changes. And more importantly, what was easily measurable was the platelet, which is a culprit for heart attack and stroke, because it's one of the blood cells which is involved with formation of blood clots. It initiates the formation of blood clots. And that is very highly activated in this particular time, maybe because of the various hormonal influence. So there is no doubt there is a circadian variation that is worse in the morning. So much so, people say, is it worth waking up? Because that's the time you are most vulnerable. So one way of avoiding this is to already plan the previous night what you'll be doing between 6 and 7 a.m. And maybe that's the best time to avoid all the stressful thinking and making everything pleasant as possible, or avoid stress, because that may add to the sudden increase in not only the blood pressure, also the heart rate.
And do you think that's the reason people say doing meditation or even prayers in the first thing in the morning is so much better because it calms you down? Do you think there's something in it?
There may be. In fact, spiritually, they got it totally right that the best time to wake up is at least an hour before the sunrise. So in the UK, hopefully it's at 5 a.m. or the later 6 a.m. There has been several physiological explanations for that. And coming to the waking up, one very important aspect, again, is relatively new for us, I'm sure to most people, the importance of sleep. A perfectly nice nocturnal or nighttime sleep is absolutely important for the heart, brain, and blood vessel. There's no doubt whatsoever. They have proved this with 160,000 patients. And most people get it right, more than the diet. They will say, if I say I sleep for 7 hours, it is reasonably accurate. So the best time to go to bed is 10 to 11 p.m. You should never go to bed after 11 and not before 10 if you can avoid it. And you should wake up around 6. The minimum time of sleep should be 7 hours, preferably in the nighttime. If you sleep for more than 8 hours, you increase the risk of any event by 5%. If you sleep for more than 11 hours, you increase the risk by almost 50%. So there is a consistent dose-related risk. So the more you sleep, the more risk of all these events, and also less sleep. So if you sleep for less than 7 hours, especially less than 6 hours, but there may be some genetic variation. People argue, oh, I sleep only for 4 hours and I'm very healthy. There must be some genetic factor as well, but the individual will know how much sleep they need for them to function perfectly well.
And also perhaps it is the quality of sleep they have as well, isn't it? So some of us perhaps need
No
a bit
doubt,
more sleep.
yes. It's not the time you spend on the bed. I think the quality of sleep is important. For that, there is a condition associated with overweight, is we call obstructive sleep apnea, where the quality of the sleep is very poor, and that has a very direct effect on the heart, causing high blood pressure, irregular heartbeat, and enlarged heartbeat, and various heart conditions. So we know the extreme example where the sleep is disturbed, it affects the heart and also indirectly the brain.
Thank you so much. I'm sure you have convinced everyone, because after the chat I had with you, I am a night owl, totally night owl. But after I spoke to you, I definitely went to bed 10 to 11. I was thinking, I better look after my heart. I have to go to bed. So I'm sure you have managed to convince everyone on the platform as well that it is something people have to give attention to. Thank you so much. Generally, we all agree across the board that prevention is better than cure. Our parents have said, elders have said, and we are now telling our younger generation as well. But can you please educate our audience how we can care for our heart? Yes, prevention is good, but what we must do and must not do. Of course, you have talked about sugar, and now you have talked about sleep. Is there anything else we should bear in mind?
Of course, yeah, there's a lot of other things you can do. One very important risk factor, as I mentioned, the 3 negative risk factors were, other than the nutrition, was the physical activity. If you take a chair and cigarette smoking, chair is more a risk factor than smoking. The reason being, if you are less active, if you are more sedentary, that is an independent risk factor for heart disease, atherosclerosis. So it's better to move around, and the recommended exercise is 30 minutes minimum per day for minimum 5 days. And again, they are very specified that 2 days should not be consecutive. So you don't have, oh, Saturday, Sunday, I won't exercise the rest of the day. So it should be in between, minimum 30 days, and ideally should be for 150 minutes per week. But not everyone can do that. But even when you are seated, if you move your limbs, whether upper limb or lower limbs, that itself count. Or if you just get up and walk, very minimal physical activity also count, for various scientific explanation for that. And one thing better to avoid, again, is relatively new thing. It has not been emphasized before, is strenuous activity is better avoided. They may be good for your appearance, maybe to impress others, but for the heart health, you don't have to do that strenuous activity. Don't strain your joints. As long as you have done 30 minutes where you had a very comfortable conversation with your colleague or friend, even on the phone, then that is a reasonable exercise for heart health. But if you are exercising to lose weight, and then there's a different story. They are having various things like interval training and various things where you may alter the basal metabolic rate. So you must decide what purpose. You must have a very presumed goal, and you can do it. And the most important, there are so many benefits. There are 2-3 pages of benefit about exercise. The most important benefit is you feel better. You feel energetic because the endorphins are secreted, and your satiety, you don't feel hungry to eat all the time. So there are lots of benefits. More importantly, the direct benefit is it gets rid of the bad cholesterol. More importantly, one easy way of improving your good cholesterol is enough exercise. It is better than alcohol.
When you talked about satiety hormone, I was thinking about, we all are talking about interval fasting now, isn't it? So how effective it is really?
Very effective, no doubt whatsoever. One of the very common complaints is they say it's all right, you starve yourself, reduce your calorie intake and everything, and you achieve it, but no one maintains it. But why that is, they have found a reason. Because when you reduce your weight and when you starve yourself, your metabolic rate also goes down. And so there is a rebound phenomenon happens and your satiety doesn't go down. So you started eating. When you finish your dietary plan, achieved your goal, that is when you start overeating. To prevent that, the best way of having a very healthy diet is fasting. Intermittent fasting has lots of health benefits. For example, it reduces the ghrelin hormone, the hunger hormone. And also it improved the satiety hormone. It increased the insulin sensitivity. You name it, everything about fasting is good. And ideally, anyone over the age of 40, it is recommended they should fast every other day. But I think that maybe if you're really health conscious, but at least twice a week. And when I say fasting, the best fasting time is 24 hours. Which in the past used to do a spiritual fasting. They say only just water or black coffee if you are that craving, but otherwise no food. So you can't eat even carbohydrate. And it is tolerable because when you don't eat anything, you don't feel hungry, except at that time, because of the habit, you may get this ghrelin increase, which is a hormone of appetite or craving. But that fortunately, the body is a very marvelous thing. It will always protect you. But after an hour, if you can preoccupy with something else during that time, your usual meal time, then you don't feel hungry and you don't say, I'm doubly hungry now because I skipped my lunch. No, you get over it. The ghrelin level comes down. So a complete fasting, ideally for 24 hours, is very healthy and you can sustain all the beneficial effects. If you can't do it, the time restricted fasting, we are 16-8 or 5-2 or whatever it is, but at least you must have 16-hour fasting, no food, so that body will start burning the fat and insulin level will go down.
Thank you so much. We all have its toll in our life. My grandmom used to say, actually, that you have to have your breakfast like a king and lunch like a queen and whatsoever. So, and we all think breakfast is the most important meal. So what are your thoughts about it if intermittent fasting is the best way to go forward?
I also thought so, but I think the evidence is completely other way. Again, I would say a U-turn. Breakfast is not important. They used to say, eat like a king for the breakfast and all these things. In fact, the most important thing is you don't have to eat 3 times. There are 5 things happen why we are now suffering with all these diseases and obesity. We eat more frequently than necessary. We ate more fast food. We drank a lot of fructose, that is fruit juice. And the 2F, which we should have done, is we are eating much less fiber, 1/10 of fiber than used to. And also we are doing more frequently. Very important thing is you have to eat only twice a day if you want to eat healthy. That's more than enough. And that you can restrict within 8 hours. So you can either skip the breakfast or dinner. But if you believe still breakfast is important, then you have breakfast and lunch and no dinner. Preferably anything after sunset, if you eat, they are usually stored. So you can choose, but skipping breakfast itself is not a bad idea. So less frequent meal. And also the important thing about the breakfast, never, never, never have sugar for breakfast is a very bad thing. Because if you prime your body and the brain, particularly hypothalamus, that I have enough sugar in my body, so it will start secreting more insulin. So the body decides today, whatever he eats, I'm going to store into fat, because insulin is a fat storing hormone. So if you prime your body in the morning with breakfast insulin, so the rest of the day, whatever you eat goes into visceral fat. So at least to fool the body, better not have. This has been proven by several practical demonstrations that if you have a donut for the breakfast, for lunch, automatically you will go for a high carbohydrate diet. Whereas if you had omelette or something high protein in the breakfast, you will automatically avoid any starchy food. So one trick you can play is avoid starch altogether, but if you can't, at least avoid starch for So avoid bread for breakfast.
And no more cereals, I guess, because most of
The high carb cereals we should avoid. Yes, high fiber cereal like oats may be okay.
Thank you. As you mentioned, some of us, for whatever reason, some individuals are more prone to heart problems. So what can we do to modify these risk factors for those individuals who already have high risk?
Yeah. So as I mentioned, so you can do that physical, it's never too late. That's the important thing. In fact, anyone who already suffered a heart attack or stroke, if they do exercise, that is more effective than most of the medication we know. So you can, age is not a matter. So physical activity is very important, very effective, whatever the age, whatever the condition of the disease. Now, anyone can just click in the computer and know what is their risk of developing heart disease. We call that a Q risk 3 score, which was updated in 2018. And what is fascinating about that is you don't have to go to your doctor to know your risk of developing a heart problem within the next 10 years. Even if you have already got heart disease, you can click that and put all your details like age, blood pressure, your cholesterol level, your good cholesterol level, various other, and even your postcode matters, because if you live in a very posh area, you live longer because of various reasons, maybe stress and various, and also maybe you go to the gym like that. There are a lot of factors. So if you click into Q-Risk3, two things it will give you, two numbers. One is the 10-year risk of developing a cardiovascular event. If it is more than 10%, you need not worry, but then you must make sure that your cholesterol level is checked and is kept under control. Your blood pressure is checked and kept under control. Your blood sugar is kept and checked under control. Your waist circumference is checked. We know what is the ideal waist circumference for an Asian. And there is a difference between women and men. So men below 90 centimeter and women below 80 inches, sorry. So we know each measurement, which is better, and blood pressure we know. And so if it is more than 10% over 10 years, easy to remember, do all these things. Even otherwise, if you are worried, you can have this regular health check. Once you know your risk is high, you can try all this, what we call a non-pharmacological, but please do not ignore pharmacological. In fact, I used to say that medication, what we prescribe, has more scientific evidence that they are good than the food you eat. None of the foods you eat, maybe except very few exceptions, has been proven to be good, but every single medication we prescribe has been proven without doubt that they are good, and none of them have any permanent side effect. A classic example is this statin. I know there are a lot of controversy. There's not a single study on statin which has not been shown to be beneficial, and almost 100% of the statin trials, they prematurely terminated because they are so good. The independent trial collaborators recommended in all these trials, please stop the trial now. And even the dummy group, please prescribe statin because it is so good. And the evidence is in millions. It's not 100,000 patient evidence you have. For example, they did a study in 94 and presented, oh, this is a wonderful, it's saving lives. And then British Heart Foundation recommended a 20,000 patient study, 6,000 patients with diabetics and 14,000 patients with heart disease, and gave simvastatin 40 and proved, my God, this is amazing drug. It is saving lives, preventing stroke, preventing heart attack, preventing heart failure. It does everything. Since there's several studies done and not a single exception which has not been shown, and they are very safe, very safe. As long as you use the right dose and use the guidelines saying that don't use this drug with this drug. And if you know the recommendation, then they are very, very safe. In fact, so much so, once they thought to put statin in tap water. They're so good, like water.
Thank you so much. I think it's really important for people to know. because I want to pack as much as information as possible. So I'm going to ask the next thing. What I wanted to clarify is, most of us know superficially what are the signs and symptoms to look for. However, I have heard that women might have a different signs and symptoms, and that's why their heart attacks get missed mostly. So what are the signs, as an expert in the heart, what are the signs we should look for?
For coronary heart disease, there are two main symptoms. One is the acute chest pain, that is chest pain severe enough, sudden onset. As you already alluded that in the early morning, they wake up with chest pain. So sudden onset of chest pain, significant enough to cause vomiting and sweating, you should never ignore. Anyone over the age of 30.
So sorry, 1 minute.
Sorry, anyone over the age of 30 in men and over the age of 40 in women, but if they're diabetic, even younger, with chest pain, they should not ignore. You must find out what is causing the pain. And if it's an acute pain, you shouldn't even call your GP or wait for the next morning. You must call 999 in the UK. And even in other countries, they must have some sort of emergency arrangement. This is given number one priority. There's nothing to beat this. Anyone with chest pain, the ambulance will arrive within 8 minutes is the maximum delay, because the single most common mode of death in heart attack is a very fast heart rate, what we call ventricular fibrillation. It can be very effectively treated back to life by giving a shock. For that, you need a defibrillator, and all these ambulance crew are trained and they have this defibrillator. So get the defibrillator to the patient with chest pain as early as quick as possible. That will save life. And the second reason why it is given number one priority to straight to the no A&E, no ward, straight to the catheter lab, where they look at the arteries, find where the block is, and unblock it within 60 minutes. By that, they prevent or minimize the damage to the heart muscle, because the time is very crucial. So that's an acute presentation with chest pain. But a lot of patients say we had chest pain. Oh, it's not a pain really, doctor, it's a discomfort. Any discomfort between the tummy and the jaw is cardiac until proved otherwise, particularly if it comes on with emotional stress or physical exertion. So that needs investigation. And every hospital in the UK, 240 hospitals have a rapid access chest pain clinic. Without any delay, they will make the appointment and they will arrange appropriate investigation and treatment, so that by which we have already reached the target of 2040 of reducing the number of heart attacks, number of patients with established heart problem because of this efficient service and early diagnosis.
Do women have different signs, or is just a myth?
Very good question. We thought so, but I know women are different in so many ways than men, but not in this aspect. They are good historians. I think it is partly the blame is the medical profession. We thought they are different. And also we thought they do not get heart problem. That is not true. In fact, they have more chance of having a heart problem than some of the other conditions like breast cancer. So we must have equal suspicion whenever we see men or women that it is possible it is a cardiac problem. So we shouldn't underestimate their risk. So especially if they have other risk factors like family history. Family history is the other thing we should never ignore. There's a very, very interesting study done in Denmark, because their health system is different. Everything is electronically documented. So under the age of 35, sudden death, they investigated and identified around 1,000 patients with unequivocal heart attacks. 9 out of these 10 patients had prior medical consultation. And what is very important is these risks, the only risk factor they identified is family history. So when a young patient comes with chest pain, and particularly if they have family history, we should never ignore, even if it's an atypical presentation. There are very simple, no risk involved investigation like CT scan, which will clearly tell us whether they have artery disease or not with 100% sensitivity, and simple blood tests like cholesterol. And in fact, the familial hypercholesterolemia is one of the common risk factors for family history of heart disease. It is 100% treatable, not 99.9%, 100% treatable. They can lead a perfectly normal life without any coronary artery disease, if they have been picked up at the age of 10 and started on statin. And in fact, in all over the world, including US, the pickup rate of familial high cholesterol is 1%, which is tragic. So any young person that is under the age of 60 for men or under the age of 65 for women, if there is a family issue heart problem, at least check your blood for cholesterol. And if it is high, very, very easily treatable. And the best way to treat high cholesterol, that alone won't help more than 10%. So please take statin, very safe, very effective. It will allow you to live longer and happily.
Thank you so much. These are the things I think we all have to learn, because we have been told different things by different people at different times. That's the reason I asked the question. I know, including my own parents, used to take aspirin for a long time because they both are heart patients. Are there any long-term effects if someone takes aspirin for a long time? Because that's another thing we hear, like statins.
A good question. Aspirin is a lifesaver. Everyone with vascular disease, whether it's in the carotid artery, the coronary artery, or perivascular system, should be on aspirin every single day without exception. Ideally, they should take it in the morning with food. And low dose is good enough as 150 milligram. In US, they use 125, we use 75. 75 is equally effective. So aspirin 75 is a lifesaver. And you asked me, by using long-term, any harmful effect? There can be, but it can be detected and prevented, like gastritis is very common with chronic use of aspirin. So by checking regular blood count, if the hemoglobin is low, or if they get heartburn, there are counteractive medication like what we call PPI to block the acid production. But even better news is now we have another drug called clopidogrel, which is 5 times more effective than aspirin and is more gastric friendly. So if people are intolerant to aspirin, because some of the asthmatics can't take aspirin, and because of the heartburn, then they can take this clopidogrel. Even in gastroenterology, recommend yes, and you can use clopidogrel, even though it is stronger, as long as there is no cause for a bleeding, it is more effective and more gastric friendly. So there are alternatives, but whatever drugs we prescribe or we recommend for cardiovascular patients, they have absolutely strong evidence to have benefit more than the risk.
Thank you. But I think one thing people have to be aware is when you have cochlear, is that correct? Because I know as a dentist, when someone comes to me and if I have to have an extraction, I will take a step back and ask the doctor whether I can do the extraction. So people have to be a bit more cautious with the other procedures. Is that true?
Absolutely true, because it's a strong antiplatelet. So anything which affects the platelet function makes you bleed more. So clopidogrel being stronger than aspirin, you have to be a bit more cautious about clopidogrel. And if it is safe to do so by the consultation with cardiologists, then you have to stop it for 7 days before doing any procedure to minimize the risk of bleeding.
Thank you so much.
Welcome.
So what medication do you commonly use and for what particular purpose? Like everything else in medicine, are there any new developments in the field of cardiology as well?
Yeah, of course, there are so many new developments. But first to talk about, we already discussed about aspirin, the value of it, clopidogrel, and sometimes we use both together. And the reason is, particularly in patients who had a heart attack, they have to use 2 antiplatelets up to minimum 1 year if they had a heart event. Or if they had a stent, maybe at least for minimum 1 year. And if they have another risk of a blood clot, like irregular heartbeat, like atrial fibrillation, sometimes we give 3 blood thinning medication, but we carefully monitor the risk of bleeding, because whenever we prevent this with blood thinners, we also have a risk of bleeding. Now, other than these blood thinners, statin we discussed, absolutely wonder drug, and other drugs called beta blocker. Beta blocker is like a cushion to the heart. So if someone already had a heart attack, we always prescribe beta blocker. It prevents this sudden surge in blood pressure, sudden surge in heart rate, which is important. And not only that, beta blocker is very, very effective in improving the heart function, because after a heart attack, one of the common consequences is they can have a weak heart muscle, particularly the left heart muscle. We measure it by a number. We call it left ventricular ejection fraction. So anyone with a left ventricular ejection below 50% need to be on a beta blocker, because it improves their function reduce the enlargement of the heart, and it save life. And also beta blocker regulate the heartbeat, prevent the sudden death, very well known. Especially if they are under stress or extreme physical activity, beta blockers very effective. And of course, beta blocker is also the very first known blood pressure medication. But because now we have got so many advanced, highly effective blood pressure medication, beta blocker is now the fifth choice. So we never use beta blocker primarily as a blood pressure medication because we have 4 other better drugs which are far more effective. So it is important to use them rather than beta blocker for blood pressure medication. So every single medication we use usually have more than one benefit. And you asked about any new invention. Yes, there is. So there is a particular class of drug, 2 classes of drugs called, one is dapagliflozin or empagliflozin. They were originally diabetic drugs. And they act in a very unique way. They get rid of the sugar, excess sugar, and get rid of the excess sodium. So ideal drug because they get rid of the 2 toxins of the body, salt and sugar. And they decided on several large trials to show that they are still okay for heart patients. But what they pleasantly found out was they are not only safe, they are highly effective in preventing cardiac death, preventing stroke, in preventing admission with heart failure, preventing enlargement of the heart, preventing kidney damage. So there are multiple benefits, let alone the weight loss, particularly the fat loss. So now they are cardiac drugs. So it has been licensed to be used as a cardiac drug, this class of drug, even patients without diabetes, particularly if they have a high risk of developing coronary heart disease or cerebral disease, or if they already had a heart attack or heart failure. They are wonderful drugs, very well tolerated, no monitoring involved. So they are really blessing for cardiac patients and diabetic patients. In fact, there are lots of new drugs that have come for both diabetes as well as heart, which immensely help. There's another drug. We used to use ramipril, perindopril, and those two. Now, actually 2014, so 8 years ago, far superior drug has come called Entresto. So again, they prematurely stopped the drug, stopped the trial and said, no, this is a wonder drug. Why don't we prescribe this? They fast-tracked through the licensing and we started using. So there are so many medications available in patients who already have had heart attack. So it's never too late, but please use these drugs in the appropriate dosage with appropriate advice. They are wonder drugs. They are better than heart transplant. If you use this drug from the beginning, they will do wonders.
That is, it is a miracle. If it is better than heart transplant, it couldn't be better. Anything else couldn't be better.
In the right patient, yes. This is what one heart transplant doctor told me and told in the national conference. It is good.
Thank you so much, Dr. Ranjadayalan. Thank you for the very interesting and informative talk today. I'm sure everyone on the platform will agree that we have gained a lot of valuable information. So what are the 5 must remember or must share tips for our audience?
So you want me to summarize all what I have said? So I think,
at least 5, because there has been so much information.
So whether they have heart condition or not, any adult should stick to diet, physical activity, as well as the mental health. Very important. And diet, we have said enough about, what is the right food and things, what is the right time, and we are eating more and more frequently. So we can, if you can cut down that. Then having a health check is important. And if you identify you have a family history, then better to have certain checks like blood pressure, blood cholesterol, blood sugar. And earlier you pick up this condition, they are easily treatable. In fact, it is well proven for diabetes and hypertension and for high cholesterol. If you bring that down to normal, your risk is 0 to like a person without this condition. So the drugs are so good, your risk level is brought down to 0, provided you use the right dosage and bring it to the level rather than saying, oh, this is enough, doctor. So it is important, all that. And if you get symptoms, again, please don't delay, because we have much safer, much more accurate investigation. For example, if someone want to pick up, have I got any heart disease, they can have a CT scan. In certain countries, if you go and tell the doctor you have a family history, you are worried and you want to know whether there is any early fatty deposit before getting symptom, you can have a CT scan and they will give you a score, what we call a calcium score, and they will tell you there is a 20% narrowing, so you better start using the statin. So we can even diagnose subclinical coronary heart disease. The technology is so advanced, you can have all these tests and lead a healthy life. The earlier, the better pick up, at least when you get symptoms. In the UK, we never investigate for routine or primary prevention. But if they have symptoms, we investigate with and you have spoiled for choice what test to do, whether it's CT scan, whether MRI scan, whether it's a nuclear scan, depending on what's the question you need the answer, we can provide the appropriate test and the answer so that you can live happily with appropriate management.
Thank you so much, Dr. Ranjan. We have got so many questions already coming through to ask, so I will be asking those questions a bit later. How has been your experience as a speaker and an expert on this talk show? Any suggestions or feedback, please?
No, it is a very good talk show. I hope the people who listen benefit that, because the format, I like it, is very good. So you ask the question and I try and give you the answer. So that's a good format. This is it's not a criticism, it is just a suggestion or it's just a thought. I'm talking and I'm giving my view in a way. Of course, it's not my personal view, it's all scientific, what I gathered from various people and various paper and publication in all the well-reputed journals and what we learn. Because our day-to-day life is that about treating cardiac patients, and so we should know thoroughly before advising what to do. But whether if anyone has a different opinion or wanted to clarify, there must be a lot of clarification, or why can't I use this oil and what is the evidence you have? So there must be some sort of interactive session where they are free to ask me or even challenge me and say, oh, I know the other way and like that. So it's always good in that way. I don't know whether that's possible. Otherwise, it's a very good format and I'm pleased I participated in your program. Thank you.
Thank you so much. Hence, we have in the 90-minute session. So the next 30 minutes, trust me, there will be many questions and there will be people asking challenging questions as well. And a lot of medics on the show. I'm sure many people will ask many questions. Thank you so much.
Thank you.
A huge thank you for you. Next week, it will be Meet Menaca episode 91. It will be how to thrive in finance as a woman or as a man with Sobita Sashikumar. Sobita Sashikumar, she's a Bachelor of Electrical and Electronic Engineering, Imperial College, currently a Senior Director and Consultant at UBS Investment Bank. Sobita brings with her a wealth of experience, having worked across the financial and banking sector in London for over 20 years. Having studied engineering at Imperial College, she decided to move to a career in the city quite early on. She works with senior management to help save costs through her successful leadership of global teams to drive successful business outcomes. So her experience spans from major banks like HSBC, NatWest, Deutsche Bank. They are just to name a few, particularly for our younger generation, as parents, as friends. Please come and listen and share this knowledge and bring your children and friends' children as well, so that they can benefit and they have a wider choice to choose. We have joked about it many times at this platform, because as Asian parents mainly, we restrict the options for the children, mainly doctors, dentists, solicitors, accountants, or no career at all. And it is rapidly changing. Hopefully, people like Sobita, who comes and talks, will bring a different perspective. Now, over to Dr. Lakshmi Velayidar to give the vote of thanks.
Hi, thank you very much. So it is indeed is a privilege and pleasure to know you, Dr. Ranjan. We truly appreciate you coming to this talk show and sharing this wealth of knowledge. Is absolutely amazing. So you, in fact, made the most difficult topic sound so easy to understand. I think you literally covered everything possible. And I'm so grateful that you touched, including the fact about the stress. I think now, I don't know how women feel now, especially those who are working. I feel the stress level is much more higher compared, I feel, maybe 20 years ago, because they're working and things like that. And we also mentioned about, in my talk on menopause, we mentioned about how estrogen and the stress work against each other as well. Likewise, after the age of 60, the cardiovascular disease among women goes high. So it is very good to see, that you have emphasized those importance, including about the diet and the importance of cholesterol and being on nystatin. I think it's absolutely amazing to hear all that valuable information. And thank you very much. And I also thank Menaca for making this. The questions were absolutely amazing, Menaca. It was so relevant for the public, and it kind of covered literally everything I could think of for heart disease. It's amazing. Thank you very much.
Thank you so much, Lakshmi. Thank you once again, Dr. Ranjadayalan. Like Lakshmi mentioned, you have covered a wide variety of information about heart, and I think we all have learned a lot. So huge thank you. And thank you so much for all the audience who come week after week. This is the 90th episode, who come week after week and support us to share this information widely. And thank you so much for people who are listening on Facebook and who have supported us on YouTube. And hopefully this will make a positive impact across the globe widely. That is the intention of this show. So huge thank you for everyone. Once again, really privileged to have you. I know you're an expert. You have won awards. You speak in very prestigious platforms. So once again, thank you so much, Dr. Ranjadayalan, for coming and gracing our stage for sure. Thank you so much.
It has been my pleasure. Thank you so much.
So next show is not on the coming Sunday, on the 5th. We are on holiday. We are coming back with our episode 91 on the 12th of June with Sobita Sashikumar to discuss how to thrive in finance as a woman. For people who are listening to us on Facebook, it has come to that time of the day to say goodbye. Have a great bank holiday for people who are in the UK. And I know Monday is a bank holiday in the US as well. So have a great holiday, and we will see you back on the 12th. Until then, stay safe, be happy, and keep smiling.